So what am I seeing in terms of patient experience trends? A couple of things. One, there's definitely more attention on it, which is really, really good. I mean, before people would just sort of give it lip service. Now I think people are actually doing some real things around patient experience. Things around like actually helping them make appointments, helping them contact their providers and so forth. So that's one big trend. The other big trend is, of course, they're doing more things electronically and digitally. So instead of like just phone calls and letters and those kinds of things, we're definitely doing things on websites, on portals, those kinds of things, which is just fantastic. We live in 2019 now. And technology is part of our lives. We use it every day. We use it when we go shopping, we use it when we go driving. And so I think when we look at healthcare, you have to look at the world in which patients and physicians and clinicians all operate in. We use Google, we use Amazon, and then we kind of got to question ourselves and go, why isn't that in healthcare? Why isn't that same convenience there? So technology is here to stay. There's no going back. But I think what we're now realizing in healthcare is, hey, we can learn from some of these other industries like retail, like finance, and bring those into our industry in healthcare and make a big difference for all of our stakeholders. Social media, one of my favorite topics. I am addicted to Twitter. I freely admit that. I love it. And I love it not because I like to tweet. I love connecting with people through social media. And I think that's the key to proper use of social media. It's not a broadcast channel. Please stop just broadcasting your company news through it. It's all about engagement and establishing relationships. And through that, I've met so many wonderful people, so many amazing organizations. And so for me, social media is a way to connect. And that can be connect with customers if you're sort of on the vendor side, but also can mean connect with patients. Connect with fellow patients if you are a person with a chronic condition. Connect with physicians who maybe are doing clinical trials or drug companies who are doing clinical trials. There's just so much of a world on social media through Facebook, LinkedIn, and of course Twitter and Instagram. It's a great way to connect with within the healthcare industry. One of the communities that I helped to co-found is called HCLDR, which actually means healthcare leaders. And what it was created to do was just create an opportunity for people to gather once a week, every Tuesday night, 8:30. We've been doing it for 7 years straight, where we just talk about healthcare and healthcare issues. And it doesn't matter if you're an actual healthcare leader, or if you're a physician, a clinician, or if you're a patient, or just somebody who's interested in healthcare. You can come and talk and learn all about that particular topic. So we publish a blog ahead of the chat, which happens again every Tuesday, and our website is hcldr.org, and you can find out more information there. And please join our chats on Tuesday at 8:30 p.m. Eastern.